We were started a couple of years ago in 1892. So we've been around for 133 years. We were started in Fremont, Nebraska by 2 Lutheran ministers that got together and said, we need to stop these orphan trains from going through, and we want to keep these kids in one spot. They're getting traumatized. From there, we've grown a little bit. We've got offices spanning from Council Bluffs to Scotts Bluff. So we've got a few stops in between, Grand Island, Lexington, North Platte, a handful of offices between Omaha, Lincoln, and our office in Fremont as well. So, like I said, we were started 133 years ago. About in the 1950s, we became a nonprofit, a 501c3. And from there, we've expanded our services to meet the needs of the communities that we serve. So what that means is we have programs. Well, let me backtrack. So one of my jobs is to educate you on what we do. And if somebody comes to you and says, hey, what does Habitat for Humanity do? We all know what that does, right? They build houses. Or what does Make-A-Wish do? Well, they help children. So somebody once asked me, well, what does LFS do? And I said, well, I took a deep breath. And then right before I could get off every program that we have, which is around 40, a friend of mine stepped in and said, you help everyone. So what that means is we have something to help everyone, and we try to serve the needs of everyone that we can. So we have programs that cover children and family services. We have behavioral health, mental health services, and then we have refugee and immigration services. And under that, we have all of the programs that we serve. So I'm going to hand it over to Michelle to talk about some of the programs that we have.
I am our Central Region Vice President with Lutheran Family Services, and I function in the behavioral health space. I cover from Lincoln to Kearney, like straight up and down. So I get the Grand Island area. This is a new position, so I'm newer to the Lutheran Family Services, but I'm really excited to be here and be able to start working and getting to know you all here in Grand Island. Like Kyle talked about, we have a number of different programs. Under the Children and Families programs, we have adoption, we have foster care, we do adoption counseling, we have a new program called Smart Gen Society, which does education around being safe on the internet for kids. We're actually looking at expanding that program to also help those older adults, with scams and things like that. So helping them to also be safe on the internet. We have healthy homes programs in Omaha. We have a fatherhood program that's pretty strong within our Children and Families program, helping dads just kind of connect back with their kids. Does even like career counseling and things like that, assisting with resume building and kind of all of those things. And then on the behavioral health umbrella, we do both for adults and youth. We do evaluations, we do assessments, we do individual counseling, we do family counseling. We have substance use services, intensive outpatient programs. We have therapists that are trained in different evidence-based models to serve people. So we have some EMDR therapists and some DBT therapists. We also have some care and service coordination, which just kind of comes in and helps to wrap around individuals and provide some of that case management and support while they're in the community. We have peer support. That's another program that we have under our health and wellness. And then here in Grand Island, we have a really strong presence with our co-responder program. So we actually have a therapist who is embedded within the Grand Island Police Department and within the Hall County Sheriff's Office. So if you are working with somebody or have an incident and maybe that individual has maybe some more behavioral health needs, maybe some mental health might be under the influence and you have to get law enforcement involved, you can ask that a co-responder come with them. So you have that trained therapist to assist with that de-escalation, and then we'll focus on that individual and help get them supported and into services if they would like to. So definitely take advantage of that program here. We're seeing a lot of success with that program. Law enforcement really likes having that program here. And then we also have some crisis services in this area. And we have some of our immigration and refugee services in this area. And we also have a really strong vets program. So I'm actually going to hand it over to Matt to talk about his program.
A little bit about myself. I did 22 years in the Marine Corps, retired out in 2023. and was kind of, well, what do I do now with my life as an adult? So Lutheran Family Services had a spot open for program director for our military and service veterans program, and they saw fit to hire me, which was a blessing. Didn't know what I was quite getting into. It's very diverse on what we do and who we work with. We work with everybody from a vet's kid, an active duty personnel, a spouse, a widow who's 95, kind of, and everything in between. It can be somebody that is suffering from substance abuse to somebody that just got out of the military and now they're like, I need a little direction. How do I get connected with the VA, or so on and so forth. So we kind of have a three-tier kind of under our umbrella, so to speak. We have peer support, which is the basic common understanding of peer support, which is, suffering from substance abuse, addiction issues, and kind of walking with that person, as well as kind of more of a modified version of peer support, which is veteran to veteran, kind of takes one to know one kind of mentality. Veterans, we are kind of a different beast, and we're very proud of that fact, and very proudful at times too. So sometimes having that walk of life experience, we can kind of come alongside and kind of work with them in that regard as well. The next is care and service coordination. Kind of, as was spoken before, that wraparound care, connecting the dots, getting them to who they need to get to, whether it's housing issues, VA issues, and so on and so forth. And then last is kind of just case management. Come to us, kind of walk you through the different programs that we have, as well as the community has, and just kind of get you in touch with that person or that entity. Another relationship that we do have is with the VA here in town. Grand Island is lucky in that regard to have the facility that we do. I know the VA is not always easy to deal with. I don't know if we have any other veterans in the audience or parents of veterans or military personnel, but the VA can be a difficult beast to deal with. Just navigating it, as well as just getting seen there. So we try to help in that regard, know some of the who is who in the zoo here in Grand Island, as well as Lincoln and Omaha. So we can kind of help expedite if need be, but also just kind of be that connecting piece. We'll go to the appointments if the veteran wants that. If they don't, that's fine. Not a big deal, but we want to make sure that we provide the best service possible for those folks. Some examples, something very basic. There was a veteran, a young guy, probably 24. He had just got out of the Air Force. And he moved back here. I think he was out in California, moved back here, and he just needed to try to start his VA claim. And so that was something that we were able to come alongside. There's experts that do this, and we know who they are. We know the process very well, so we can kind of go along with it as they have questions and work with, a veteran service officer or a national service officer, depending on who they want to go to. There are some folks that aren't very good at their job, and we know who those folks are, so we can kind of steer them in a different direction. So they make sure they work with the folks that actually do care and are invested in them. Another example, a little more dynamic. There was a veteran, he was Vietnam War, he was Army, had some substance issues. He knew this, and he started working with one of our staff members. He didn't really want help, but he wanted help, if that makes sense. So it was a lot of patience, a lot of just staying with him, baby steps along the way. He ended up going into an inpatient program. He did that for actually 120 days and came out, and he backslid right away. And then staff members still along with him, got him back into an inpatient program. He's now been sober for 90 days, which is awesome. And this is out of program. He now has a job, just got his VA claim back. He's 100%, which is phenomenal. He rates every bit of that. And he is independent. And that's the whole goal, is to make sure that all of our veterans, the families, that they are able to be independent and feel good about themselves and who they are and what they can bring to the community as well. So that's kind of it in a nutshell.